Delta variant on track to become dominant cause of Covid-19 globally. The more transmissible Delta variant of the coronavirus is on track to become the dominant form globally, experts tell New Scientist. Now detected in at least 85 countries, its spread has triggered new lockdowns and other restrictions across the world. I know that globally there is currently a lot of concern about the Delta variant, and the World Health Organization is concerned about it too, said Tedros Adhanom, Director General of the WHO, at a press conference on 25 June. Data from science analytics company Airfinity records Delta as the second most dominant variant of concern globally, a designation used for more transmissible, harmful, or vaccine-resistant versions of the virus. At around 80,000 cases detected to date globally, it still lags behind the 1 million detected cases of Alpha, the variant of concern first identified in the UK. But Delta's rapid dominance in the UK shows how fast it can spread, even in a country with high vaccination rates. Delta was first detected in the UK in mid-April. It now accounts for 95% of all new cases and had delayed the easing of restrictions. The variant is also spreading fast through Europe. It may become dominant across Europe, and cases seem to be increasing exponentially, says Caroline Casey of Airfinity. In Portugal, Delta already amounts to 70% of cases in the capital Lisbon. The European Centre for Disease Control projects that by the end of August, the variant will be responsible for 90% of cases in the European Union. It wants an acceleration of EU vaccination programs, noting 2 doses provides nearly equivalent protection against the Delta variant compared with older variants. Other parts of the world are also struggling with the ease with which Delta spreads. Lockdowns have been imposed in Sydney, Australia, and surrounding districts following more than 100 cases of the variants. Israel has reintroduced a mandate on face masks just 10 days after lifting it, following imported cases of Delta. In the US, the number of cases of the variants had increased from about 10% of infections on 15 June to around 20% now. Researchers in South Africa say new infections are dominated by Delta. Even Singapore, a country that fared well in controlling earlier stage of the pandemic, has seen the variants become dominant, though daily case numbers remain very low in the double digits. Unless something else comes along, Delta is probably going to outcompete all the other viruses around, maybe with the exception of the Beta variants, says Ravi Gupta at the University of Cambridge. But Delta looks to be more transmissible, so it will probably spread faster than Beta. Health authorities in the UK estimate Delta is about 60% more transmissible than Alpha. A recent paper by Gupta and colleagues found Delta not only spreads more easily than previous variants, but is better at evading the protection provided by current vaccines. The research, not yet peer-reviewed, was based on more than 100 healthcare workers in India inoculated with the Oxford AstraZeneca vaccine, while the vaccine's efficacy was reduced. Gupta says the findings show that it is still protective against severe disease. Eric Topol at the Scripps Research Translational Institute in California says it is just a matter of time until the variants make significant inroads across South America. I don't think there's any question about that Delta will be globally dominant as it has shown exponential growth on multiple continents now, including Europe, North America, Africa, and Asia, he says. The international spread and toll the variants takes will largely depend on vaccination status and how many people have immunity from previous infections, as Topol. Places with high vaccination rates like the UK and Israel are unlikely to see a significant rise in deaths, and the hospitalization rates are clearly flatter when the older, higher-risk people are predominantly vaccinated, he says. The big danger from Delta's global spread is for countries where relatively few people are vaccinated, says Gupta. It's going to lead to a great disruption and a large number of deaths in places where there isn't much vaccines, he says. Gupta is also concerned about high levels of Delta leading to a new mutations of the variant.